Title: Alpha Adrenergic Antagonists. All right, my future nurses and doctors. Today we're talking about alpha adrenergic antagonists, aka alpha blockers. These meds are game changers for blood pressure, urinary problems, and even PTSD nightmares. Stick around, because I've got a fun memory trick, simple breakdowns, and must-know nursing alerts to help you never forget. Let's get into it. What are alpha adrenergic antagonists? All right, let's break it down super simple. Alpha blockers work by blocking alpha receptors, which means relaxing blood vessels and reducing resistance. If alpha agonists were like a fight or flight response, alpha antagonists are like hitting the brakes. Alpha blockers relax blood vessels. So if someone has high blood pressure, enlarged prostate, BPH, or circulation problems, these meds help by relaxing everything and improving blood flow. Memory trick: alpha blockers relax and release. Here's how you'll never forget alpha blockers. Just remember, alpha blockers relax and release. Alpha blockers relax and release. Relaxes blood vessels, lowers BP. Relaxes prostate muscles, easier urination in BPH. Releases tension, used for PTSD and nightmares. So when you think of alpha blockers, think of relaxing everything: blood pressure, urinary issues, and even anxiety-related tension. Common alpha adrenergic antagonists. Know these. All right, let's talk about the biggest players in the alpha blocker world. Prototype drug, prazosin mini-press. Our prototype drug is prazosin, which is used for both high blood pressure and PTSD-related nightmares. Prazosin, press down BP and calm the brain. Other alpha blockers you need to know. Doxazosin, Cardura, used for hypertension and BPH. Tamsulosin Flomax, BPH only, helps men pee. Phentolamine, used for reversing adrenaline overload, like from pheochromocytoma or alpha agonist overdose. So, if a patient has high BP, they'll likely get prazosin or doxazosin. If they have prostate issues, they'll probably be on tamsulosin. Common side effects: low blood pressure, because vessels are wide open. Dizziness and fainting, especially first dose, called first dose phenomenon. Reflex tachycardia, heart beats faster to compensate. Nasal congestion, because blood vessels in the nose open up. Biggest thing, orthostatic hypotension. These meds cause a big BP drop when standing up, so patients might feel dizzy or even pass out. Nursing alert: first dose phenomenon. Who should not take alpha blockers? Contraindications: hypotension, BP is already low, we don't want it lower. Severe heart failure, can worsen symptoms. Taking other BP meds can cause an extreme BP drop. If a patient already has low BP or heart failure, alpha blockers can cause too much relaxation and make things worse. What foods and meds to avoid? Major drug interactions. Avoid these while taking alpha blockers. Alcohol can make BP drop even lower. Other antihypertensives risk for extreme hypotension. Erectile dysfunction meds, Viagra, Cialis, etc. If a patient is on alpha blockers, they should be careful with alcohol and ED meds because they all lower blood pressure. Overdose: here's the antidote: fluids and vasopressors, reversal for low BP. If a patient overdoses on an alpha blocker and their BP tanks, we treat them with IV fluids and vasopressors like norepinephrine. And of course, monitor them closely for signs of shock or fainting. Nursing alerts: monitor BP, watch for hypotension. Teach slow position changes. Prevent falls from orthostatic hypotension. Give first dose at bedtime. Avoid first dose fainting. Monitor for dizziness and nasal congestion. And one more tip: alpha blockers take time to work. Patients might not see results right away, so remind them to stick with it. Boom! You just mastered alpha adrenergic antagonists in under 10 minutes. Now you know the memory trick, types, side effects, interactions, and nursing care. If this helped, don't forget to like and subscribe for more easy med breakdowns. See you next time.